Welcome our students. For today, we are going to start with Unit 6, which is entitled Symptoms. We will describe symptoms and how to form questions. Let's start. Symptoms are the physical conditions that indicate an illness and are usually described as either strong, mild, or weak. إذن الأعراض هي حالات جسدية التي تشير إلى وجود مرض، وعادة ما توصف هذه الأعراض إما بأنها قوية، خفيفة أو ضعيفة. Many illnesses have symptoms in common, such as nausea, high blood pressure, etc., whereas other symptoms are rare and specific to a narrow range of illnesses. هناك العديد من الأمراض لها أعراض مشتركة مثل الغثيان، نوزيا غثيان، high blood pressure ارتفاع في ضغط الدم وغيرها. بينما هناك أعراض أخرى والتي تكون نادرة أو مخصصة لمرض معين. إذن هذه الأعراض تكون خاصة بأمراض معينة. The most important symptoms that leads to diagnosis is called as cardinal symptoms. ويطلق على أهم الأعراض التي تشخص المرض بالأعراض الرئيسية cardinal symptoms أو الأعراض الأساسية. And the symptoms that cause a patient to seek medical help are referred to as presenting symptoms. بينما تسمى الأعراض التي تجعل المريض يطلب الاستشارة الطبية ب presenting symptoms. Symptoms are the things that are noticed by patient, whereas signs are the objective evidence of an illness, which can be observed by doctors and others. إذن هناك فرق بين الأعراض والعلامات. الأعراض هي ما يشعر بها المريض، ما يعاني منها المريض ويلاحظها، بينما العلامات هي دليل موضوعي على وجود مرض ما، أي أن الآخرين يلاحظون وجود هذه العلامات وليس المريض. إما الآخرون هم من يلاحظون العلامات أو الطبيب. So pain is symptom and a low blood cell count is a sign. Some features can therefore be both signs and symptoms. إذن فإن الألم هو من الأعراض وليس العلامات، بينما انخفاض خلايا الدم هذه هي علامة وليس عرض. بعض الصفات ممكن أن تكون بنفس الوقت هي علامات وأعراض. Now move to page 35, language spot, in which we are going to explain how to form questions. How to form questions. There are several ways of asking a question. These are generally divided into those that require only a yes/no answer and WH questions, which ask for specific information. So, in English, there are two basic types of question: yes/no questions and WH question. Let's start with yes/no questions. These begin with auxiliary and modal verbs such as do, does, did, am, are, is, was, were, etc. So, this type of question starts with auxiliary or modal verbs. With the present simple, we use the auxiliary verb do. If the subject is I, you, we, or they, we use the auxiliary verb do plus the subject plus the infinitive verb. While if the subject is he, she, or it, we use does plus the subject plus infinitive verb. For example, do you have a sore throat? Yes, I do. No, I do not. With past simple, we use the auxiliary verb did plus the subject plus the infinitive verb. Did she see the doctor yesterday? With the present perfect, we use have or has plus subject plus past participant form of the verb. We use has with third person singular, he, she, it, and we use have with we, I, you, and they. Look, verb to be and modal verbs such as can, will, may, or might aren't formed with the do, does, and did. With the present simple, we use a present simple of verb to be plus subject, then the question mark. For example, is the hospital near here? With the present continuous, we use a present simple of verb to be plus subject plus verb ing. For example, is the pain getting worse? With modal verbs, we use modal verb plus the subject plus infinitive form of the verb. For example, could you give me your name? Could is modal verb, you is the subject, and give is infinitive form of the verb. Another example, may I leave, please? May is modal verb, I is the subject, and leave is infinitive form of the verb. Now let's move to the second type of question. WH question. We begin with a question word when we want specific information. So, this type of a question is used when we want different kinds of information. These questions cannot be answered with a yes or no. Question words include what, where, who, when, why, which, and how. We can use who to ask about a person. For example, who is the doctor? What is used to ask about thing. For example, what are your symptoms? Whom can be used to ask about nouns in object. So to ask about object, we use whom. For example, whom did you see? When is used for time or date. So we use when to ask about time or date. For example, when is your meeting? Where is used for a place. For example, where is the city hospital? Why can be used to ask about a reason. For example, why are you late? Which is used for a choice. For example, which color do you want? How is used to ask about manner. For example, how is your health? Look, we can use how in other combinations such as how long, how far, how safe, how much, etc. Now let's move to question tags. We often use question tags to check information, to express surprise, or to be friendly. A question tag is a short question that we add at the end of statement. So we use question tags when we want someone to confirm information. The verb used in a question tag depends on what? Depends on which verb is used in the statement. Look, usually we use a negative question tag after a positive sentence. For example, Lisa will be here soon, won't she? John should pass the exam, shouldn't he? While we use a positive question tag after a negative sentence. For example, you haven't eaten yet, have you? Another example, Mark doesn't look well today, does he? So, we use negative question tag after a positive sentence, while we use positive question tag after a negative sentence. Now let's move to the question without a verb. In conversation, we may make a question without using a verb if we think the meaning is clear enough. So the meaning here is understood by the hearer. For example, sure, which means are you sure? Any question means do you have any questions? Any pain means do you have any pain? Thank you for your listening.